we will discuss anatomical terminologies. Like other language, English, Urdu, Pashto, we are using different terminologies. For example, upper, lower, in front, in back, inside, right? There are some specific terminologies used in anatomy, because anatomy is coming from Greek wording. So in Greek wording, the terms which are used for this upper, lower, sidewise, middle, we will discuss that terms today. There are 3 or 4 things which are must in anatomical terminologies. The first is anatomical positioning, movements, right, and direction. There are 3 types of terms: anatomical directional terms, directional terminologies. Directional terminologies. The second thing is movements, movements of body, and the next is anatomical planes or lines, and in last we will discuss the positions, right? This very simple thing. Directional terms are movements are anatomical. There are specific terms which are using for upper, lower, etc. For example, the first thing here is anterior. Anterior. Second, posterior. These terminologies are also in comparison, right? We will compare two. This anterior is used for front of body, to front, right, and posterior is to back. For example, sternum is on anterior side of body. Sternum is on anterior side, right? And for example, scapula is on posterior side of body, right? Sternum is on anterior because in the front, and scapula is on posterior side, back side. The next is superior, and fourth one is inferior. These two terms are opposite to each other. Superior is for upper, mean here the upper thing is towards head, and inferior away from head. So superior is used for towards head and away from head. For example, eyes are superior to ears, right, and ears are inferior to eyes. It is used for towards head and it is for away from head. There are 4 terms which can be used as alternative wording for anterior, posterior, superior, and inferior. They are ventral. Ventral is used for front side, right, and dorsal is used for back side. But specificity is ventral and dorsal are used in one organ, and if we are talking about the whole body, we will use anterior and posterior, right? For example, the anterior horns of spinal cord, the posterior horns of spinal cord. We are saying that ventral horns and dorsal horns, right? For superior, we are using cephalic. And for inferior we are using caudal. right? But specifically, this cephalic and caudal are used for brain and spinal cord, right? But this is same thing. Cephalic is for superior and caudal is for inferior. Cephalic is towards head and caudal is away from head, right? The next thing, lateral. Lateral and medial. Lateral and medial. For this lateral and medial, the midline and sagittal line, the mid sagittal line is very necessary. So in anatomical planes, we have first midline, midline, or it is also known as mid sagittal plane or line, right? This is the line which divides the body, but these lines are imaginary, right? These are imaginary line drawn on body which divides the body into two equal right and left halves, right? This is called midline. For example, if we have a body, right, and we are drawing a line on mid of this body, this line is called midline. This is called midline because it divides the body into right and left equal halves, right? So the things which are towards midline are called medial, and which are away from midline they are called lateral. So lateral is away from midline, away from midline, and medial is towards midline. For example, heart is medial as compared to lungs, right? Yeah, heart is medial and kidney is lateral, right? The next thing is this lateral is divided into two. One is contralateral and one is ipsilateral, right? One is contralateral and next is ipsilateral. When two organs or two structures are on same side of body, they are called ipsilateral, and when they are on opposite sides of body, they are called contralateral. So on opposite sides of body and on same sides of body. For example, if we are taking a body here, and this red is medial line, this is midline, which is dividing the body into right and left halves. For example, this is the heart of this body, right? And also we have appendix here, right? These two organs are on opposite side of body, so heart and appendix are contralateral. And if I am taking spleen here, for example, here is spleen. So spleen and heart is ipsilateral because it's present both on left side, same side. So when the organs are present on same side of body, they are called ipsilateral, and when they are present on the opposite sides of body, they are called contralateral, right? The next is proximal and distal. Proximal and distal. Proximal is towards roots or origin, the area from where an organ is starting. The starting point of an organ is called proximal, and the positions or the sides which are away from that origin, they are called distal. For example, this is towards origin, and this is away from origin. For example, this is the proximal side of humerus, proximal side, and this is the distal side of humerus, right? Yeah, for example, if we are taking nephron, I am taking nephron. This is nephron, right? This side of tubules is called proximal convoluted tubules. Proximal convoluted tubules. Why? Because this is towards origin. It is starting from here, right? And these tubules are called distal convoluted tubules, right? For example, if I am taking scapula, this is scapula, and this black is humerus. This humerus is starting from here, so this is the proximal end of or proximal side of humerus, and this is distal side. These are the general terminologies which are important in anatomy study, because we will use all these terminologies in coming course, right? The next is anatomical movements, how we represent the movements of body. Terminologies which are used for these movements. The first one is abduction. Abduction, and the opposite to abduction is adduction, right? Abduction is used for movements away from trunk or body. So these are the movement away from trunk, right? For example, if my hand is moving like this, it is away from body. This movement is called abduction, right? And when I am adding my hand to my body, this is called adduction. This is movement towards body or trunk, right? For example, if I am moving my hand towards my body, this is called adduction. This is called abduction. This is called adduction, right? For example, again we are taking this body here. For example, if he is moving the hand, this is the normal position of hand, right? And if this hand is moving like this is called abduction. And when this hand is coming again to this original position, this red line shows adduction. This is adduction and this is abduction, right? The next movement is flexion and extension. Third one is flexion and extension. Flexion and extension. Flexion is some term which is used for contraction, and extension is for relaxation again, right? And this movement is specifically used for bones, joints movements, right? When two bones are coming close to each other, this is called flexion. And when these two bones moving away from each other, this is called extension, right? So this is in this, the organs or bones move close to each other. ठीक ना? कोई के पदी इसका ना extension, and extension is opposite movement to flexion, and this bones will move away from each other. Mean that the angle between bones is decreasing here and the angle between bones is increasing here. For example, if I am taking the example of my elbow joint, right? For example, this is the humerus, this is the radius, and this is the ulna, right? When these bones are moving towards this bone, right, and the angle between these two bones, for example, this is the movement. After movement, the angle between these bones is decreasing. This angle, this is called flexion. This green movement is called flexion, right? And when these bones are moving again in this direction, right, this angle is now increasing, and this red movement is called extension. Now in hands and legs, this movement is opposite. For example, this is the flexion of hand, but this is the flexion of foot or leg. This is on dorsal side of body. So flexion in legs is called dorsiflexion. Dorsiflexion is dorsiflexion. This is called the flexion movement in legs, right? The flexion in legs is called dorsiflexion, and extension is same. Pronation and supination are rotational movements. Rotation movement is the movement around its axis. The movement of an organ around its axis, this is called rotation. The movement around axis is called rotational movement. But rotational movement is also divided into two: the lateral rotation and medial rotation, or the pronation and supination. So it is divided into lateral rotation and medial rotation. When the rotational movement is toward away from midline, this is called lateral rotation. For example, if I am moving my head like in this direction, this is towards lateral, away from midline, this is called lateral rotation. And when I am moving again this head towards midline, this is called medial rotation. If I am moving my head towards right lateral, this is called right lateral rotation. This is called medial rotation. This is called left lateral rotation. So these are the rotational movements. The next is supination and pronation. 6 is supination and pronation. Movements towards supine position, or movements to achieve supine position is called supination, and movements to achieve prone position, it may be of an organ or whole body, right? For example, this is supine position of my hand, this is supine position of my leg, this is pronation. This is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my hand, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg, this is pronation. This is supine position of my arm, this is supine position of my leg right? When I am moving my hand like this and achieving the prone position, this movement is called pronation. And when I am moving again this prone position into supine position, this is called supination. Pronation, supination, right? The next is eversion and eversion. Inversion and eversion. Eversion. Inversion means movements inside. Inside movements are called inversion and outside movements are called eversion. For example, this movement is inside. This is inside movement. This is called inversion and this is called eversion. Inversion, eversion, right? The movement in legs are same like in hands. This is inversion. This is eversion. So inversion is inside movements. And this is outside movement. And last, we are showing all these movements in one word, which is called circumduction. Circumduction is when all these movements occurs together. This is called circumduction. For example, abduction, adduction, flexion, extension, rotation, all these movements when occurs together, this is called circumduction. So these are the anatomical movements terminologies, right? The next thing is anatomical planes or lines. What is anatomical plane? All the imaginary lines are planes drawn on body which divides the body into two or more than two parts, right? For example, the first one is midline dividing the body into two equal right and left halves. But if we draw a parallel line to this midline which is dividing the body into two unequal right and left halves, is called parasagittal or sagittal line. So the next one is sagittal line or plane, right? If I draw a line parallel to this midline here or here, this is called sagittal plane or line. So we can define the sagittal line, a line drawn parallel to midline. What is parallel? Which cannot cut the other line, right? For example, this and this line is parallel to each other because they are not cutting each other, right? Or we can define this imaginary line drawn on body which divides the body into two right and left unequal halves, right? This is called sagittal line, or it is also known as parasagittal line, and this is midline, or this is called mid-sagittal line. Why these lines are important? In radiology or imaging anatomy, these lines are very, very important, because when you are taking CT scans or MRIs of body, for example, you want to take the MRI of left side, you must scan the body on this line. You will take this side. For example, if you want to take the CT scan of upper side of body, upper stomachs, you must know these lines, because when you are capturing this area, you will take the images of upper areas of body, right? So the next thing is transverse plane or line. This line will divide the body. It divides the body. No. You will not use upper and lower now. Right? It will divides the body into superior and inferior halves. Right? For example, this is the body, right? And I am dividing the body into superior and inferior side. This line is called transverse, or it is also known as axial line, right? And we can define this line, a line drawn perpendicular to midline, line drawn perpendicular to midline. This is perpendicular because if I take this midline, it making 90 angle to transverse line, right? And when two lines are making 90 angles to each other, it's called transverse, right? Or it is also known as horizontal line. Horizontal. It is also known as axial line, right? The next is coronal line or coronal plane. It will divide the body into anterior and posterior sides. So it will divide the body into anterior and posterior sides, right? We will take this line on sidewise of body. For example, if I cut the body on this area, I will take the anterior and posterior. For example, if I have a body sidewise, right, and I take this line. This is the interior side of body and this is posterior. So this line is called coronal line or coronal plane, right? The last one is oblique line. Transverse line will make 90 angle with midline, and if we take line on body and making the angle greater than 90 or less than 90 with midline, that line will called oblique line. For example, if this is the body, right, and this is the midline, this is the midline, and I draw a line like this, or I am drawing line here or here. These lines are called oblique line because they are making angles other than 90 with midline, right? So these are the planes or lines of body. Just like this, we will divide all the areas or regions of body. For example, this abdominal area, this abdominal region is divided into 9 parts, 9 further parts, right? This chest area is also divided, oral cavity is also divided, right, on these lines, right? With the help of these lines, we will divide the body into sections and regions, right? Now we will go for anatomical positions, right? देख के समझ नहीं हुआ है